All right, we're about to wrap up house calls, but we saved the best for last. Dr. Edward McCarron, surgical oncologist at MedStar Franklin Square Medical Center, also the Bel Air campus. Let's talk about melanoma. Doctor, are women more at a greater risk for developing melanoma?
Right. The quick answer is no. Men are more likely to develop melanoma. The American Cancer Society has predicted that about 100,000 people will be diagnosed with melanoma. 60,000 will be men, 40,000 will be women. The important thing is that varies with age. So before the age of 50, women will be more likely to be diagnosed with melanoma than men.
Now, what about in terms of treating it? This is something that you can catch early and it can be treatable.
Right, exactly. So the treatment is so important because it's simply wide local excision. So if you go for a biopsy and you're diagnosed with an early stage melanoma, surgery will result in the cure. So like I always say, early diagnosis, quick cure.
What about women if you're pregnant? More of a threat?
Well, that's such an important question. Because the majority of women diagnosed with melanoma, a third of women diagnosed with melanoma will be of childbearing age. The impact of the hormonal changes of pregnancy upon the risk associated with melanoma remains controversial. Fortunately, the majority of the evidence does indicate that pregnancy-associated melanoma will not have a greater risk. Also, hormone replacement therapies have not been associated with a greater risk.
So what are the risk factors?
The risk factors are certainly excessive sun exposure, number one risk factor. So I advise all my patients use sunscreen, stay under the umbrella, stay out of the tanning bed. Your skin type can also play a role. So people with fair skin, light hair, blue-green eyes, people who burn easily will be at increased risk. But melanoma is about 20 times more common in whites, but also people of color will get melanoma, and people of color should realize that, and they should keep an eye on the palms of their hands, the soles of their feet, because they can also be affected by melanoma.
Well, you know, I know that's an argument I always have with our husband. Put on your sunscreen.
Absolutely.
You still need it if you have darker skin.
Yes.
So how is it diagnosed and treated?
Okay, so the diagnosis is by a skin biopsy. The public service messages have been great in having everybody understand the ABCs of melanoma. So if you have a mole that's increasing in diameter, changing in color, developing irregular borders, please get a biopsy, because like I said before, the early diagnosis is a quick cure.
All right, well, thank you so much, doctor. Thanks for all you do and have been doing, and all the folks at the hospital during this pandemic. I'm sure things have been hectic all over.
It certainly has. You're very welcome. Thank you.
All right, we're going to wrap it up here. The phone number to call right there on your screen. You got about 15 more minutes before our experts wrap it up. But again, that's 410-671-0702. Taking all your cancer-related questions here with our experts from MedStar Health.